Okay, we're going to start our next session. Richard Kollmar is the first speaker.
All right, everybody. Hello. Thanks for having me. So I will not talk about winds and frizzles, but I will stick to nerve regeneration. I'll talk about a recently started project about a year ago to develop a device for the treatment of facial paralysis. I'd like to acknowledge my collaborators, Dr. Ofo Azule. He's the chief of robotic and microvascular head and neck reconstruction in otolaryngology, and Mark Stewart, who taught me, among other things, that you use urethane when you work with rats. And the work that I'm going to show you was done by Takesha Moranci, who is a third-year medical student. She had an alumni foundation fellowship for a year, and Stephanie Tominaga, a third-year ENT resident, who had some funding from the department. All right. So what are we trying to do? We are trying to improve, in the long term, clinically, the treatment of facial paralysis. The facial nerve, shown in yellow in this diagram, innervates most of the muscles in your face, and thus is responsible for proper mimic, proper facial expression. It can be damaged in various ways. Some of them sort of resolve themselves. But chronic paralysis, if you have a big tumor, for example, that destroys the proximal part and leaves only the degraded distal stump of the nerve, is a problem. It's very distressing for the patients because it takes away your facial mimic, and then it leads to sort of disturbed social interaction. If you look at somebody and they have a funny face, that's not good. It can actually have other complications, like if you don't blink regularly, your eyes dry out, you can actually go blind from that. So there are important reasons to treat this. Unfortunately, the current approaches to treat are pretty much limited to surgery alone. You hook up the distal nerve stump on the paralyzed side to an intact nerve, maybe the hypoglossal nerve, or you do a cross-face connection to the facial nerve on the other side. These are difficult surgeries, and the success rate is very variable and unpredictable. So what we would like to do, what we would like to try, is build on the surgical approach. We will still hook up the distal nerve stump on the paralyzed side to a functioning nerve, but then we will not have that nerve drive the newly re-innervated part of the face. Instead, we will record on the intact side of the face the electrical signals and try to, in a symmetric fashion, to stimulate the distal nerve stump on the other side using some sort of a small implant. Now, to show in principle that this is doable, we using right now an animal model, the rat. The rat doesn't have as many facial expressions maybe as you and I do, but they have a very sophisticated whisker system. They have very fine motor control of the whiskers. They can actually use their whiskers like their hands. They can sort of feel up whether a surface is smooth or rough and so on. So the whisking is our proxy for facial expression. And we've been working on a setup to monitor that. So here's our little friend, anesthetized with urethane. Both facial nerves are surgically exposed behind that white wall. One of them on the right side is transected, and so the whiskers on the right side are paralyzed. And then we have a recording electrode on the whole nerve on the right side. We feed the amplified input into a hardware discriminator that detects electrical activity on the intact side. And if it does, it triggers a stimulator, which then zaps the distal nerve stump of the paralyzed side and induces, hopefully, a movement of the whiskers. You see that a couple of those whiskers are darker. That's because we've threaded a very thin, dark tube on them so we can see them more easily. And we can film that whole thing with a high-speed camera, 240 frames per second, high-definition video, and monitor the success of our stimulation. So this is our setup, and we went ahead and tried to test this. Does this work? Can we reasonably quantify whisker movement, and B, can we stimulate synchronously? Now, so far this has been only done in acute preparation. We want to make sure our setup, our system works before we do laborious long-term surgery and regeneration studies. And so I'm going to take you through the record about 5 seconds from one of these rats. We start out with the electrical recording from the intact nerve on the right side, on the left side, and you see these somewhat irregular bursts. So each of them is a volley of action potentials. Some of them are more dense than others. And then if in parallel we plot the up and down motion of the whiskers, of one particular whisker on that side, on the intact side, we see that with every burst in the nerve activity recording, we have a movement of a whisker, sort of an oscillation back and forth. Now, our hardware discriminator picks up those bursts in the top recording. The signal-to-noise ratio is pretty good. And so every one of these vertical lines here is a trigger signal to our stimulator. And then finally, at the bottom is the movement of a whisker on the paralyzed side. And that you see that every movement on the intact side is mirrored by a synchronous movement of a whisker on the paralyzed side. So our stimulus system works very nicely. So we are happy with that. And what are we going to do next? First of all, as I said, this was an acute preparation, and we haven't really refined the stimulus protocol much. If you think about in the long term, we are stimulating, at least that's the plan now, the whole nerve. But we want to be able to sort of elicit maybe a variety of facial movements. So we want to test all the parameters of the stimulus protocol, the frequency, the duration, the amplitude, and so on, whether we can elicit different whisker movements in the rat, and therefore can expect that we may be able to elicit different facial movements in the human. And then the second goal, and that's the real test of this whole idea, is to damage, to injure nerves, facial nerves, do a repair, wait for reinnovation several months, and then go back and ask in the reinnovated rat, can we stimulate in a systematic fashion and again cause symmetric synchronous movements on the intact side and on the regenerated side. That's it.
Richard, you did that with a minute to spare.
Very good. Thank you. My garage closes at